Good evening. Namaste, everyone, and thank you for being here. We had some difficulty in the beginning, so looks like everything is okay. And give me 1 second. The technology is not the best thing sometime, and we, even though are presenting this, which is looks like is running now, but we had some issues where for some reason the internet was not the perfect. So our topic for today is dementia and Alzheimer. Again, Alzheimer, as we know, is a big problem for elderly population. Usually as we age, like everything else, physically, mentally, things slow down. But what we are seeing that when we look at the dementia, is just a combination of symptoms. It is not just basically when you see memory loss and you see that people are not able to communicate that well, or they're not able to solve the problem, and we're not sometimes remember the things, remember the names. So it starts saying, but again, memory loss should not be considered as just dementia or Alzheimer. It's just a phase that as we are aging, sometimes for many reasons we do lose that memory, small amount. So when you look at the overview of dementia, 5% of individuals over age 65 and 35 to 50% of individuals over age 85 have dementia of some kind. Is that preventable? To some extent, and that's what we are going to talk today. Alzheimer's disease is the most common form of dementia in the elderly. Accounts for 60 to 80% of dementia. Prevalence of Alzheimer's disease is increasing for many reasons. 5.2 million over 65 had Alzheimer's disease in 2012, expected to reach 6.7 million by 2025. And then in some reports, you see the number is much higher. And so again, that definitely is the issue, but again is increasing. And that is why we are talking about this topic today. So goal of these discussions is not to cure or treat any condition. Basically, this is a educational lectures, and our purpose is to give you some background, some information. So to some extent, we are able to do self-care and able to prevent from many diseases to actually manifest in the individual. But in some cases, like which you look at Alzheimer, in the modern medicine, there's no cure, there's no treatment, but we are keep treating the symptom. But in Ayurveda, they're saying that you can prevent the progression. So wherever it is, you stop that, and people who are not there, then they can prevent from happening by taking care of themselves. So we like to know what causes that. And so we are able to take care of ourselves. So looking at the DSM-5 criteria, again, these are the books where they are saying there's our mental conditions. These are the criteria. If you see that, that is how you diagnose the condition. Evidence from the history and clinical assessment that indicates significant cognitive impairment in at least one of the following cognitive domains. At least one: learning and memory, language, executive function. So where basically you cannot execute any function, you are trying to do something and not able to do that. So basically these things affect the daily living in these individuals. Complex attention, and if there is any complex work need to be done, putting things together, and you're trying to connect the dots, then these individuals get nervous, anxious, and kind of lost, don't know what to do. And sometimes it has been seen, there are individuals when they're driving and they all of a sudden they are in an intersection and busy, and then people are blowing horn and they just forget where to turn, if the light right or left or go ahead, and just basically that happens. So basically in this case, when there's any complex attention, it becomes a big issue. Perceptual motor function, social cognition is also a big thing. Impairment must be acquired and represent a significant decline from a previous level of functioning, must interfere with independence in everyday activity. So in that case, when you are not able to, or individual is not able to have an independent living, and that becomes the issue. So anytime there is interference with the daily task, anything which they're doing on daily basis is impaired, then we know that person is developing dementia. In the case of neurodegenerative dementia, such as Alzheimer's disease, which is the most common of neurodegenerative disease, the disturbances are of insidious onset and are progressive. So it just progresses fast based on evidence from the history of serious mental status examinations or serial mental status examinations, where you look at the mental status and then how it grows. The disturbances are not occurring exclusively during the course of delirium. Disturbances are not better accounted for by another mental disorders or by other mental disorders. So basically, we're looking at the DSM-5 criteria. Based on that, if you see if we have find any at least one of these, then we know the person is actually have a diagnosis. Again, continuing the DSM-4 and 5 criteria for dementia, we are looking at the difference in the DSM-4 and DSM-5 is major neurological disorder or neurocognitive disorder. So in one more memory impairment, two, at least one of the following: aphasia, apraxia, agnosia. So you look at those, again, there is a lot to be covered in this 1 hour of time. And many of you will be able to get these slides through the library, and then you can just study those. Basically, goal here is to see if there is someone in the family or somebody you know, and if you can help them out. Again, these things are available to study. Many individuals I see who have the conditions, since this is the only condition or any condition they're dealing with, they will collect all the information. But what to do with this condition, or what to do with that information, what to do with that, all the compilation of data they have, that is where we stand to make sure that we're able to help these individuals. Clinical presentation, many do not present with the complaint of memory loss, because what happened, many individuals, even though they have memory loss, they do not even realize that they have the memory loss. Informant reported memory loss is a better indicator. So in that case, when we find out that the person who is bringing them with them, a family member, is the one who is telling that this person actually is basically is losing memory. So in that case, when we see that person who is affected have no idea that this is happening, is the family members who are able to tell that they forgot the name, or they were driving somewhere and they got there and they did not know where they are, or then coming back, then the police officer called that this person is at this gas station or that particular place and looking for the house. And so many times we find these individuals have those conditions which actually is better reported by the informant, by a family member, by somebody else, whereas sometimes they don't even recognize they are losing the memory. Normal cognitive decline associated with aging, mild changes in memory and information processing. It just takes time to understand something. Usually do not progress and do not affect daily function. That is normal. Aging associated with the decline in learning, but not memory retention. So those are normal decline. Again, as we age, again, depending upon how much activity we were doing when we were young. So it's always suggested that you keep your brain active, like we do the physical activity to keep physically strong. And same thing with the mental activity to keep ourselves mentally strong. So we're able to, many individuals I've seen, they're working with puzzles and playing with the puzzles or connecting things. So in that case, they are keeping themselves busy, even just playing cards, remembering who had which card and which cards are gone, which cards are still out. That is also exercise. Problem is happening when an individual is sitting in front of the tube and watching television all day, and so there is no physical or mental activity. They're just sitting there. And so we see that when that population is growing, there is definitely a decline in their cognitive function, and mentally they are not able to basically connect the things when they are acting, when they are going there to learn more. And as we age, we just start losing fast. But normal cognitive decline is the aging process as we age. Patient with dementia may have trouble with retaining new information. You keep repeating, and every 2 minutes they said, "Oh, just can you repeat that what you just told me?" And we see that sometimes we are going somewhere and there are some elderly, we keep asking the same question. Handling complex tasks, putting things together, even a small paper, just filling becomes information, even though these individuals are much better and well educated when they were younger, but as they age and the symptoms start, they just do not know what to do with it. Reasoning, and we look at the special ability and orientation, language and behavior. So those are common things we see. But what is happening when somebody is coming with a disease, or say, for example, clinical signs, symptoms of dementia? Before that, they had many other conditions, high blood pressure, hypertension, high cholesterol, or diabetes, or other thing, which make it complex. Because when somebody have other condition, there are other factors which are influencing the physical and mental health, and there are emotional issues also. And so basically becomes a complex thing to handle. And again, there are individuals who have these things, but it doesn't bother them because they don't remember anything. And so in that case, their issue is pain or something else which they think bothers them. Whereas as their mental ability decline, it becomes a very complex task for the family members or the caretakers. So risk factors are age. Again, even though we are seeing these in younger generation now, genetic factors, mild cognitive impairment. We look at the motoring cognitive risk syndrome, cardiometabolic risk factors, lifestyle, gut health, hospitalizations. Basically, again, hospitalization is not a risk factor, but when somebody have been going to hospitals for frequent time, then there are many infections they may get from the hospitals, that environment. And it's supposed to be the clean, but actually we get many conditions, many diseases, many infections in the hospital. And also it indicates that if somebody's going frequently, then basically their health has some issues. Maybe their immune system is weak, or maybe they have other conditions which were not understood. So they keep going back and forth. Head traumas, a use of alcohol, excessive, chronic kidney disease, homocysteine level, dietary fat, what kind and how much, hearing loss, vitamin D deficiency. And also we're looking at the organophosphate or organochloride pesticide exposure. Again, pesticide have been discussed many times in articles, in the news. So any strong chemicals we use, they definitely affect our sensory receptors, motor receptors, or any organs which are very delicate. Mostly we're looking at when we breathe, something affects the breathing. So basically, when your lungs are impaired, you are not getting the most important thing, which the entire body, but more specifically, your brain need, oxygen. And so when you look at the oxygen, the prana, the life force, if you're not getting enough of that, then definitely it will affect the basically the health of the individual, but mostly the nervous system. You're not able to communicate very well within your own brain cells, within then connecting with the whole body. And so it affects the entire thing. So chemical use in the house, around the house, at work, and also we're looking at now environmental exposures, and that also affects. So those are definitely risk factors. Alzheimer's disease, insidious and gradual onset, goes slowly, and sometimes it takes long time. characterized by brain deterioration and buildup of proteins known as beta amyloid plaques. And those plaques are the one which are basically making the white matter declining slowly. So basically shrinking. Parts of the brain commonly affected is hippocampus and cerebellum, can lead to both language and memory impairment, and 3 stages of Alzheimer: preclinical, when we start seeing some issue at that time, again, sometime, or like most of the time, the family members, people living close, they will see that there is some issue. And if you get help immediately, then things can be stopped. What I see in my 40 years of work dealing with, people's health, many individuals, by the time they come, the disease has already progressed. And recently, in last 20-25 years, as the information is available online, everybody is some kind of doctor which is graduating or graduated from the Google University. So they will do all their own work, which is nothing wrong with it, getting information. But when they start ordering stuff online, which they have no idea what other combinations to make and what is this for, they will read something online and start ordering 1, 2, 3, 4. I've seen people taking 68 different supplements, which they think are good for them and cause more and more and more problem. So in that case, when somebody have really preclinical symptom and they see is there, they start things online and then they start taking these things. But that is the time you look for an expert, talk to someone who is dealing with those conditions, a doctor, somebody who's trained in that. Mild cognitive impairment, and basically finally Alzheimer's, dementia. And that by that time the disease is full blown and person is affected. And again, at that time, the family actually is dealing with that. So they are affected and their life becomes, in some cases, very complex, dealing with individuals who does not remember name or who does not know where they are going or coming. So basically they have physically also become impaired because they can put themselves in danger. So in that case, because of their well-being, the family becomes very concerned and extra stressful. Preclinical, no cognitive symptoms have manifested, but pathological signs can be found in cerebrospinal fluid. Okay. Mild cognitive, concerns regarding changes in cognition relative to prior functioning. The concern may be from the patient, clinician, or an individual who knows the patient well. Again, like I said, it is the family or other who see that something is happening. Evidence of impairment in one or more cognitive domains greater than expected for patient age and education. If repeated assessments are available, which are Montreal Cognitive Assessment, for example, then a decrease in cognitive performance should be evident. Cognitive domains may be memory, language, and attention. And sometimes there are a combination of all of these. Preservation in the ability to function independently with daily activities. And that actually, as I mentioned in the beginning, most of the time when the patient come, that's how they come, when they're not able to have a normal independent living. However, complex tasks may be unusually difficult. And sometimes there are, as we age, sometimes few things we cannot do. But again, in just daily things which they were doing, and not able to perform those also, they will forget things like they go to bathroom and they're looking for basically toothpaste and toothbrush in the kitchen. Then you know something is wrong when they are not able to know that actually I was going to the bathroom and they're looking at the wrong place or have no idea what they were doing. And so dealing with that for the family becomes a issue, and with that their hearing also goes down. So you're shouting and the person looks, you can see in the look, they're just lost, have no idea, they're not understanding anything. So it becomes very painful for the family when they're taking care of it. Alzheimer's dementia meets criteria for dementia, which we discussed before. Insidious or gradual onset, symptoms occur over months to years, not sudden over hours or days. So it is a very slow progressive condition. And again, but we are able to see that slowly what is happening. And so many times the family also is not aware that there are things, treatments available. They think, oh, it's just old age, so the person is getting old. Clear history of cognitive decline by report or observation, with the most prominent cognitive deficit being evident on history and mental status examination. Having just one deficit doesn't mean you have Alzheimer's disease. These deficits may include impairment in learning and recall of recently learned information, problem with word finding, deficit in spatial conditions such as recognizing object, the ability to see words or read, or inability to recognize more than one object at a time, impaired reasoning, judgment, and problem solving, cognitive decline with no evidence of cerebrovascular disease, or other conditions and medications which may affect cognition. So like I said before, many times there are the disease also involved. So we just have to be careful not to ignore other things. So anything, again, also when an individual is taken to a doctor, we just don't think we brought them for Alzheimer's. So we just tell only that, but we need to also include in the history all the other conditions person had been dealing with or was diagnosed, or had any accident or had any injury, mostly the head injury. So all these things to be revealed. So when a clinician is making a decision, they will keep that in mind, what other factors could be influencing that. General diagnostic criteria, you're looking again, the came from DSM-5. So language, learning and memory, executive function, complex attention, perpetual motor. So this is something we showed in the earlier beginning of these slides. So same thing, basically, if we see that, we know what is happening in that individual. Now bring to the Ayurvedic perspective. So Ayurveda, we mention every time in the beginning, believes everything is made from 5 elements. We call the Panchamahabhuta, 5 element theory, which is the space, air, fire, water, and earth. And combination of those makes the 3 doshas or 3 body types, Vata, Pitta, and Kapha. Vata is the combination of space and air. Pitta is the combination of water and fire. And the Kapha is the combination of water and earth. So Kapha brings all the cohesiveness, all the basically storage of energy, storage of all the information, including nutrients and also the toxins. And so that's the kapha that gives also the structure to the body, is the solid matter in the body, whereas pith is the metabolism, the energy transformation, all the enzymes, all the hormones, and vat, basically because of the air dominance, is circulation of blood, circulation of lymph, motor sensory pathways, gas exchange in the lungs and the cell, filtration in the kidneys, metabolism or digestion of the food. So all whatever is moving is controlled by Vat. So all of us have Vat, Pitta, and Kapha. And also when we consume something, it turns into these 7 dhatus. Ras, Rakt, Mams, Med, Asthi, Majja, Shukra. Ras is the main fluid, which is almost 70% of the body. Then extract of the ras will turn into blood. Extract of the blood will nourish the tissues. Extract of tissue will nourish the fat. And the extract of fat will nourish the bone. And extract of the bone will nourish the bone marrow and also the nervous system. And then extract of that will nourish the sperms or the eggs. So that is the genetic material. The essence of all of that will be ojas, the pure essence, which we call the immune system. So in Ayurveda or Ayurvedic medicine, when you're looking at the nervous system, basically it is coming from the Majja dhatu. And so in that case, when we are seeing the decline of the nervous activity, neuron activity, then we are always looking at the Majja Dhatu. So this is considered as a disease of Majja Ksha when the Majja is going down. So basically, in that case, we're looking at the Dhatu Vaigunya is a term used in Ayurveda, which means the Dhatu itself. So these are 7 Dhatu. So Dhatu is becoming inferior. Dhatu is basically either contaminated with something. Something has to be there. So in modern medicine, we don't find any cause, but Ayurveda always looks for the cause. There is something happening in the dhatus, which means the conversion from your food to fluid is not optimum. From your fluid to blood is not optimum. From blood to tissue is not optimum. From tissue to fat is not optimum. For fat to bone is not optimum. Bone to bone marrow is not optimum. And then bone marrow to the genetic material sperms. So something is happening there in the transformation. And the transformation requires heat, Agni. Maybe the Agni is not efficient. Or maybe there is something in between which is causing that delay or causing the inferiority of the dhatu just because there are other environmental factors involved. There may be, for example, chemicals where the person is working. So maybe occupational chemicals. There may be environmental chemicals. There may be environmental heavy metals, which you're looking at there are so many heavy metals, which we are concerned about. The basically the one who affect the neurons or nervous system, which is lead, mercury, arsenic, and cadmium. And so when you're looking at those, then also we're looking at the overgrowth of bacteria. We're looking at viruses in the body. We're looking at the parasites in the body. So all these factors or all these organisms can affect our body function, physical function, mental function. So in Ayurvedic medicine, we'll always look at what dhatu is affected, which is in this case, Majja Dhatu. And also in that case, we see what is happening. So when Majja Dhatu is affected, then the person is having inability to connect. Their rasayanas are going down. They're also their axons are affected. And in case of their memory, which need to be enhanced, is also declining. So in that case, we are looking at there to stimulate the nerve function. So in that case, we need to find things to clean. So in Ayurvedic medicine, we always look that if there is a cause, we remove the cause and rejuvenate the body. So there are really good effects by detoxification, which we call panchakarma in Ayurveda. So when somebody comes with those conditions, panchakarma is recommended so that we can clean the dhatu, and we can also in the meantime find what could be in those dhatus or in the human body which could be causing that. So you always look for the cause. So since this is considered as a neurodegenerative disease, we always find what is causing that degeneration. Rasayanas are used and the panchakarma therapy is used, which is very, very, very useful. The signs and symptoms of dementia could be understood, but is not disease entity, rather a natural phenomena. We're looking at the Mastishk, which is the brain, and also Mastulinga are derived from Majja Dhatu. So like I mentioned before, so that is made from Majja Dhatu. And in that case, it's like a semi-solid grita. Grit is basically ghee. And many of you know what ghee is clarified butter. And that is the consistency of that. And that need to be clean. If that is not clean, that becomes the issue. The brain consists of Indriya, Manas, and Prana. Buddhi is the ultimate function of these factors and comprise the brain. So Buddhi is basically looking at where we store information, whereas the intelligence is stored. Based on that, we are able to make the decision. Manas is the important factor in the origin of pranjana and also derived from the karmas. So that is a little complex basically discussion which we can leave for future. But at this point, we would like to look at the simplified terms. Dementia in Ayurveda is blockage of channels in the body, tissue degeneration, weakening of the ojas, and that's where the immune system is down, and that's where everything is happening, weakening of mental functions and senses, Vata imbalance leading to neurological diseases. So Vata, which actually connects everything, which moves around the body, when that becomes weak, when that is not connecting, that is not moving, the communication of neurons to neurons is not as strong as should be. And why that blockage happen? When we look at the brain, we have gray matter, we have white matter. So basically white matter starts declining. So in the clinical science, what we're looking at, the tangling of the neurons happen because the white matter hold all the neurons in place. White matter is heavy. So that ghee like substance, which is white and semi-solid, like the grease, so that holds all the neurons. When all these neurons are all going, are when the white matter start declining because of many other factors, like I said, chemical use, excessive chemical, heavy metal, bacteria, parasite, viruses. There could be so many. When that happens, or maybe sometimes the dietary changes, maybe the deficiency of some nutrients or vitamin. So when that happens in that individual, white matter is decline, and when the white matter is down, then these neurons are free and they tangle into each other, and that becomes a complex issue where basically detangling them becomes a problem. So at that point, our only thing is, why not increase the white matter? So Ayurveda looks at to increasing the white matter, maintaining the gray matter, and there are herbs which do that, which does that. In that case, we are looking at few things. When as soon as you find out, look at the individual, sign, symptom, contact a qualified and experienced healthcare provider, and then see what they could do. So maybe sometimes they cannot regenerate and they cannot reverse the condition completely, but if you can stop the progression, that's a big success in this case. So that is something we need to be looking at. Ojas is this essence related to vitality. Heavy metals and amas can contribute to mental aging. And amas are toxins. Again, like I said before, toxins could be coming from environment, could be environmental, could be biological. Detoxification helps release heavy metals and amas. Fights against aging, decay, and disease, formed during biosynthesis of bodily tissues, that is during the creation of Shaya Dhatu. So looking at all 7 dhatus, when they are being formed, that is how it is formed, and that's when it is formed. All dhatus has the capacity to create its own ojas, and also a combined ojas, which is again immune system. Ojas present in a single dhatu or cell is called localized ojas. Collective ojas in the name given to the pure essence of all dhatus, and that is basically our immune system. As long as that immune system, that ojas are maintained, then there is no reason of developing any disease at all. If there is something start causing issue, our body is able to take care of it, eliminate it, neutralize it, take it out of the body through many other channels which has for excretion. But when the body becomes weak, that is where these things take over. Liver also plays a role in dementia. Ayurveda links the liver with Agni and Pitta dosha. The movement of Vata also plays a crucial role. And again, as we know, liver is the detoxification center. So when we are detoxifying, liver plays the vital role. Liver looks at or takes the things, processes it, and separates into water soluble and fat soluble. Fat soluble is processed by the liver, goes through the process of emulsification, and the water soluble are sent to the kidneys to filter it out. So again, detoxification is very important. And again, in generally what we look at in Ayurveda, the toxins are fat soluble, so they go to the adipose fat under the skin, and they go to the brain, they go to all the glands which have fat around them for protection, and they also go to the joints. So joint pain starts coming, which we call arthritis eventually. But again, there's inflammation caused by the toxin. So in Ayurvedic medicine, we always like to see what is causing it and start removing. So aging is a natural process that should not have any disease. Slowness is normal because you can't run fast with physical, mental, those activities slow down a little bit, but not having a disease where you don't remember things or you're not able to do anything at all. So liver plays a big role. Also the gut. Every time we talk about Ayurvedic medicine, we always look at the gut connection. Where is gut involved? And in this case, we definitely have the gut connection. So gut microbes and the dementia. Looking at diet can have profound influence on brain health. GI tract also helps providing nutrients. Healthy gut microbes play a vital role in health of GI tract, which has strong connection with brain. Detoxification is the gut, and detoxifying the gut and re-establishing the gut flora is important. So we always look at our microbiome. We always look at the bacterial health in the gut. So in that case, we want to make sure we change our diet. We want to make sure we eat healthy food. We want to make sure we do not take preserved food. We want to make sure we do not use chemicals. And also the use of alcohol. So gut health is vital, because that is the only place which is going to absorb and process the food we eat and then put that in circulation. And that's how it goes to the brain. Brain itself does not eat. Brain eats whatever is supplied through our blood circulation, which is again coming as a result of what is absorbed in the gut. So gut health is very, very important. Digestive system plays a major role. Fire element governs the transformation, governs digestion, absorption, assimilation, and transformation of food into energy. If imbalance of Vata, Agni is variable. Pitta, increased Agni. Kapha, decreased Agni. State of Agni determines the health of the digestive tract. Factors that weaken it: the poor diet, insomnia, not having good sleep, suppression of emotions, and vitamin and mineral deficiency, and lifestyle. So the suppression of emotions is also a big factor, because when we are suppressed, we are stressed all the time, and that will affect the release and production of hormones in the body. And generally, actually, our life is controlled by hormones. And if the hormones are not released properly, then we can't sleep, we can't digest. Again, the body function actually is compromised. So Ayurvedic perspective of health: samadosha, samagnisha, samadhatu, balkriya, prasanna atma, indriya, mana, swast iti abhidhiyate. So Sushrut Samhita says the balanced doshas, Vat, Pit, Kapha, balanced Agni, balanced Dhatu, and also excretion, having a good bowel movement, excreting, urination, all that process is balanced and perfect. And then we are happy inside. Our soul is happy. All the 5 indriyas, sensory organs, also are happy and balanced. The sense of smell, sense of touch, sense of hearing, sense of seeing, smelling, all these are balanced. That is what we call swast. That is what is considered as the healthy individuals. When all these things are balanced, that is what health is. But having all these balance is not an easy task. So in that case, we had to make sure everything is balanced, and that is where the disease or disease starts. Pay proper attention to your gut health and detoxification organs, especially liver. Balance your hormones and ensure optimal vitamin and mental or mineral level. Ensure healthy bowel movement, proper diet, nutrition, hydration, and movement, and also adequate sleep. And so sleep is very important. So you want to make sure that our sleep is good. And many individuals who are not able to sleep start having the issue. So in Ayurveda, we always look at the Aushadhi at the end. First, we look at the diet, Ahar, Vihar, and Aushadhi. First is our diet. Second is our lifestyle. And then at the end, we look at the supplement. But here, since everybody looks for the supplement first, we put them first. Certain herbs are really well known for the nerve function, and they are there to release and have a optimum function of neurotransmitters. The neurotransmitters are the one which are actually are there so much in the brain, and they control and help communicating between the neuron. Brahmi is one combination of that. So Brahmi is a great herb, and that actually is used to use that. Bacopa is really helping to increase the gray matter. Shankapushpi is really good for the brain function. One more herb which is not here is Manduk Parani, that is also really good. Guruchi is really good. Amalaki is really good. Macuna Plex. So Macuna is really well known, basically for mental condition. Ashwagandha basically help release neurotransmitters, which is again with Withania Plex. Centella. Nutraceuticals for dementia. Thiamine is used. B12, zinc, phosphodiesterine, L-acetyl-carnitine, which is again used a lot in this condition, vitamin C and E, and fish oil. So carnitine actually is used a lot, and also niacin, which is not here, which is vitamin B3, is used a lot. And again, so that is also something need to be added there. Anti-inflammatory, Triphala for the gut health, and also Triphala is a cyan. Gugulu, anti-inflammatory, boswellia, curcumin, and saffron. So combination of these are used. Vihar, Panchkarma is useful therapy in the treatment and improving the quality of life with those with dementia. Abhyanga supports natural blood flow and decreases inflammation in the body. Shirodhara, marigold oil to help with relaxation. Svedana promotes healthy circulation. And Basti to remove ama from the digestive tract. Deep breathing always is recommended. Calm the autonomic nervous system. Yoga, increase circulation, decrease inflammation. Meditation, avoidance of pesticide and other environmental toxins. Heavy metal detoxification would be beneficial. So we always recommend a test just to see, like a hair element test to see if you have any heavy metals in your body fat. And so if that is there, then we want to clean that. Sweating to clean pores and aid in detoxification. So the Svedana is recommended where the person is sweating, and also we use ozone. And smoking actually always should be, is not a good thing to have. Should be completely prohibited. Exercise 30 minutes at least 3 times a week will be really, really good. Leafy green, non-starchy vegetables and fruits, organic foods, incorporate omega-3 fatty acids in your diet, flaxseed, chia seed, salmon, monounsaturated fatty acid, almonds, hazelnuts, pecans, pumpkin, sesame seed, olives. Incorporate polyphenols or phenols in diet, apples, almonds, berries, olives, cloves, flaxseed, spinach, avocado. Adequate water intake, 64 ounces average. Adequate protein intake. Make sure your plate is colorful, so different things. Incorporate ginger, turmeric, saffron, garlic, and ghee is very important, and fiber. So generally, when we're looking at the ahar also, we're looking at the niacin, like you mentioned before, 13 to 18 milligram per day. We're also looking at carnitine, basically, and the carnitine is very important, even though it is a amino acid derivative, which is coming from lysine and methionine. So really, really important. We also want to make sure that we use methionine, which is a sulfur-containing amino acid. So those are also used. And we herb-wise, we always recommend taking more Bacopa, which is Brahmi, or more Macuna. Like I said before, Brahmi increases the gray matter, Macuna increases the white matter, a lot of Shankapushpi, Manduk Parni. Like I said in the beginning, that the tangleness comes because the white matter is decreasing. So why not increase the white matter by having more Macuna, and also maintain the gray matter by having more Brahmi. There are a lot of other herbs also, which in combination, depending upon other cofactors or other coexisting diseases, they need to be taken care of. But then we're looking at the fat content. So instead of animal fat, Ayurveda recommends the fat which is coming from pure oils, almond oil, sesame seed oil, olive oil, and ghee actually is a rasayana, which is clarified butter coming from the cultured butter, and that is very, very important. High fiber seeds or food, apple, rich source of pectin. And also amla also a lot of peppers, so a lot of pectin. So amla is also a good thing to use. Chia seeds, beets, artichokes, barley, black beans, bran flakes, broccoli, complex carbs, fennel, green beans, green peas, lentils, lima beans, paired with skin, raspberry, split peas, turnip greens, and whole grain means 100% of the kernel, including grain, germ, and endosperm. So all these need to be used. Hydration is very important. Water intake is very important for detoxification of the system. Be sure to drink at least 70 to 100 ounces of water, depending on your weight, lifestyle, and dosha every day. So we consider 64, 67 average, but again, if you're active, take that. And with that, I'd like to say thank you for giving me this opportunity. Again, there was some issues in the beginning, but again, we're able to connect. And every month we meet. We have a clinic in Cross River. We also have a school if you want to learn Ayurvedic medicine. And you can contact us at this phone number, 914-875-9088. And if you want to be our partner in helping those who are less fortunate, we support medical camps in India, go every year to help people. We also support the education, college education for young girls. And so if you want to be a partner, definitely contact us. Any help will be appreciated. Again, thank you. And if you have any question, I'm here.
Thank you, Dr. Koch.